our own.
We are back. It's about 7:42. A stroke is the third leading cause of death in the United States. More than 140,000 people die each year from stroke in the country. It's also the leading cause of serious long-term disability in the United States as well. May is Stroke Awareness Month, and joining us today, Dr. Janalynn Beste of New Hanover Regional Medical Center's Coastal Family Medicine. Thanks for coming in this morning.
Good morning.
For those that are watching this morning, Dr. Beste, and maybe not really familiar with a stroke, they've heard it before. How about the brief update with what a stroke is?
So a stroke is essentially a brain attack, and there's two main types of strokes. One type of stroke is an ischemic stroke, or a situation where there's a blockage in a blood vessel in the brain that causes there to be decreased blood flow to the brain, and the brain can actually die. A part of the brain can die. The second type of a stroke is a hemorrhagic stroke, or a bleeding stroke, and that's where a blood vessel in the brain either bursts or begins to leak, causing blood to leak out into the brain and again not get to the tissue where it's supposed to get to, and part of the brain can die.
Do they both have the same warning signs?
They can both have very similar warning signs. So a warning sign of a stroke is any sudden symptoms, so a sudden severe headache, sudden loss of vision, inability to suddenly move your arms or legs, inability to speak. We actually have a great memory aid that we tell people to use, and that's the word FAST. And so F is for facial droop. So if you look at someone and half of their face isn't going up, you can ask them to smile.
Slurred speech also, maybe?
Absolutely. That would be the S for FAST.
Okay.
A would be arms. So you can ask them to put their arms up. If one of their arms drifts or they can't lift their arm, that could be a sign of a stroke. And the T in FAST is time, which means you should note when the time of the symptoms started and then call 911 fast.
And because of this and other medical emergencies, time when it comes to somebody having a stroke is so very important, isn't it?
Very important. And we urge people, don't wait for your daughter to get home to take you to the hospital. Call 911 and get to the emergency room very quickly. A
lot of people maybe think that strokes are maybe isolated to those in the elder category, our senior citizens. But a lot of young people have strokes.
Absolutely.
Nearly about a fourth of total strokes in the country, I read, happen in people that are not senior citizens.
Absolutely. Strokes can happen to people with a lot of risk factors. Things like being a smoker, a heavy drinker, if you have diabetes or high blood pressure, if you're overweight, if you don't exercise or eat well, if you have certain heart conditions, particularly irregular heartbeats, all of those things can put you at risk for stroke no matter what your age is.
And if somebody does have a stroke, you see somebody having a stroke, act quick. Recovery is possible. You know, it might be a long process,
Absolutely.
but it is something that they can look forward to if it's the severity of the stroke, I guess, and also the quick timing to get the help, right?
One of the reasons why we tell people to get to the hospital quickly is the only treatment we really have for the blockage type of stroke has to be given within 3 hours of the beginning of the symptoms. So if you wait longer than that, the ability for that treatment to work goes down.
All right, Dr. Beste, thanks very much for staying with us.
Thank you so much.
Coming in, stay with us for just a moment. Warmer weather is in store right now, so you can